Well, good morning, everyone. I'm Thompson. I'm the warden at the St. Mary's County Detention Center. I've only been on the job about 41 days. But I've been at St. Mary's for quite some time. I'm also the president of the Maryland Correctional Administrators Association. So many of you, I've seen your names, but have not seen you in person. Dr. Alfonso is part of our team in St. Mary's, as well as Kim in the back. And Kim can attest to the double entry that we do with the SOAR money. So we do appreciate it. So for many years, the detention center has had programming to reduce recidivism. And when grant funding was made available from the governor's office, a Vivitrol program was began. However, we found that not many opted due to the medication being an injection. And I've personally seen the needle and I understand. So in the spring of 2019, St. Mary's raised their hand to be a pilot county, implemented medicated assisted treatment for all inmates and detainees. MOUD has now changed to medication for opioid use disorder. In November, the legislation was enacted into law in 2019. In St. Mary's, we have strong partnerships with Dr. Brewster and the health department team. This partnership has been critical to our success. In short order, once we got notification of the grant monies, we began to assess our needs and line up contracts with the local methadone clinic, because in each of the counties, I know it's very easy. We have haves and have-nots. Like Montgomery County, they have a lot more haves than we do. So, and I know it's all a challenge, just saying. And we try to be the little engine that could. And we also, the local methadone clinic, because we didn't have all those regulations, but we are fortunate that we do have that, because there are other counties that do not. Pyramid Walden for substance abuse counselor, peer recovery specialist, and our medical provider Prime Care for a registered nurse. Through Derek McGregor's shop at Behavioral Health, grant monies were awarded in March of 2020. As a matter of fact, on March 10th, we were before our commissioners, and on March 13th, we shut down for COVID-19, and the rest is history. With the grant monies, we received medication costs, personnel, and we were able to get our contracts for substance abuse and for Outlook Recovery, which is our methadone clinic. So another key partnership has been with Friends Research, and Monica will go in depth shortly. However, of all the three, Friends Research is definitely the most easy. They come in, the most thing I have to do is make sure that they can get past the background. They work with Monica, and it's very user-friendly. So the beauty of the legislation is not only that it provides medication for opioid use disorder, it also ensures screening for mental health, substance abuse counseling, peer recovery specialists, and all that offenders have a reentry plan, which I think is very critical. In St. Mary's, there are 3 pathways to offender reentry. Each path has a dedicated case manager who are screening offenders to ensure the best possible outcomes through case management. The goal is to ensure when an offender is released, they have the best possible safety net to ensure success from incarceration to community. And I think that's kind of one thing that's not played up very much in the House Bill 116 is the critical piece that you do have an offender reentry. And that's what our goal is. To me, medicated assisted treatment is really, it creates some work, it does, but that's the important thing. It's no different than diabetes or any of the rest of it. It is a medical condition, so we treat it as such. And our main goal is we want that offender to be successful when they leave us. This slide displays the path an offender may take when incarcerated. If they come in, we are an arrest booking site for the state of Maryland. So they come in, they're seen by the commissioner, they're released to the community. We ensure that every person that comes through our doors, that walks through our booking area, receives the training for naloxone. We also provide Narcan to those who would like it. And we also give them a certificate to make sure that they can go to any pharmacy to get that. So we do try very diligently. So even all offenders get some piece of opioid to help the crisis. So the second path we have is through pretrial supervision. So if they're released on pretrial supervision, we immediately start case management. We assess everyone, and then they go out in the community and we hook them up so that they get inpatient. And we're very strong partners with Pyramid Walden. So they are in our community corrections center. We were able to get a office modular. My staff likes to call it out at the trailer, but really it's an office modular. So, but we were very fortunate. So Walden sets up shop there. They're in that building as well. So if they are staying in the facility, then we immediately the case manager start the path to offender reentry, and we get them hooked up with the medical services. This very, very complicated slide is the requirement of House Bill 116. If the offender's path is medication for opioid use disorder, the legislation mandates that they have a medical intake, mental health and substance abuse assessment using evidence-based screenings and assessment within 24 hours. Medication is made available to the inmate. We offer all three, so they have that choice. Pregnant females are offered MAT as soon as possible. The law requires 3 formulas. The law requires to provide behavioral health counseling consistent with therapeutic standards and access to peer recovery specialists and develop a reentry plan. Medication diversion is a serious challenge with us, but medication diversion is a challenge. I had the inmate that took and diverted Suboxone. He also took and just recently he diverted his other medications. So medication diversion, whether it's with MAT, it's a concern no matter what kind of medication we have. And the goal of the MOUD is to provide continued care from the community to incarceration and then incarceration to community. In St. Mary's, a multidisciplinary team was established to include all facets of the process. Dr. Alfonso, I've never met her in person. We have talked many times virtually. I didn't know she was sitting behind me, as a matter of fact, until she introduced herself. And Kim, she's a critical part of that. So administration, pretrial, home detention, operations, substance abuse, medical, mental health, offender reentry, and classification. We meet weekly and we discuss who's been started on the program, who we have challenges. This also extends not only to the inmates that I have that are incarcerated within the facility, it also is the offenders that I have on community corrections for our pretrial supervision program and our home detention. Because what we find is our clientele is the same, whether they're incarcerated and when they go out. Of course, sometimes we have to pull them back in for a touch up on pretrial or home detention, get them back on the right path. But there's always one piece of critical information that I did not know, and that if they'll be able to tell me if they leave, they're on our pretrial supervision program. Walden can tell me if they showed up to do their follow-up, because I'm a firm believer, sometimes we may have to bring you back. I have a place in the jail for you, but if we can get you back to a stable place, we will put you back out on pretrial again with inpatient programming. Partnerships are key. We link offenders not only for education, training, medical care, mental health, life skills, housing, employment, and inpatient treatment. As part of that multidisciplinary team, when I have our medical reports out, Kim will report out on substance abuse, their portion of it, but I also have the offender reentry piece, because every inmate, as soon as they sign up for medication for opioid use disorder, they have to have a plan. So when you leave our facility, where are you going to go? You're going to go to Recovery Centers of America. And even though we have the strong linkage with Walden, whichever they want to, or go to their private provider, it makes no difference. The main thing is you have a plan that you can work when you get out. The dictionary is the only place where success comes before work. The keys of our success are each of you, our community partners and colleagues. I cannot say how much the relationship with Gary McGregor and behavioral health and with our local health departments, with all of our providers, because it takes a great safety net to be able to get people out. So it's not only to make sure they have medication and the substance abuse training, but they have to be lined up with their mental health. We have taken, and it takes a little bit to get in with the providers, we will give a 7-day supply of medication when people leave, just because it's that important, and we want them to be stable, not only with their mental health, but also for medicated assisted treatment. And I know I joked earlier, there are the haves and have-nots. What I have in St. Mary's, Kent may not have, and but we like with anything corrections, we tuck and roll and we watch our neck because we don't want anything to happen to us. And then there was a lot of discussion about, I just apologize, I didn't catch your name, but she had talked about, about education. And what I have found with this is there really isn't a playbook. And what our best, we started with Maryland Correctional Administrators Association. Monica has been really great. We have established that we have a monthly meeting. We had a piece on like peer recovery specialists. We have Rhode Island that'll be talking this Thursday. And if you would like the link to be able to get on that. And it was very, very enlightening. And even though we have been doing MAT for a while, Rhode Island has been doing it since 2016. And I learned some things when I talked to her the other day, because there will be other challenges as you go through this. Like some of the challenges we had was that the inmates are nodding off. This lady took and sat in the day rooms, which is a concern because you need to be aware of where you are in jail. And she told me the other day, and Monica can attest, and she said, well, our theory had always been that they maybe need to take and get less medication because you figure they're being over medicated, they're nodding off, but she says they need more. So more to come. We'll have to, that'll be a good discussion for later if that is actually the case, because that was so different. So there is no playbook, and each of us in this room, we're learning from one another. We always share. I know in St. Mary's, I always share what I have. So you're welcome to it. And we have a colleague here from Allegany County. They did the research as well. And I listened to their program because they were the ones we had for the thing. And I learned stuff from Allegany, and I know Dan had gotten stuff from us. So it's very much a learning collaborative, and no pun intended. So most thing I can really say is there's no formal structure, and what's right in St. Mary's County may not be right in Montgomery County or Prince George's or Kent or Carroll. I mean, you have to take what everybody else has and make it work for you, and then get the stats that Jeff needs for the governor's office. So, and there's a piece for him as well today. So, and I'm looking forward to hearing that. So I thank you all very much for the time, and I'd like to turn the presentation over to our classification and offender reentry case manager, Monica Thomas. Monica has been spearheading our partnership with Friends Research. So thank you all very much.
Above, I will touch on the stats that Dr. Gordon shared with me last week on our facility. I am part of our adult recovery court team in St. Mary's County, and I also I'm the coordinator with Friends Research Institute. We partnered with Friends Research Institute at the end of 2019. Dr. Gordon, I did list some of your study, but I'm not going to be repetitive, so I'll skip over that. Our dates of study are from January of 2020, and it will conclude at the end of 2024. And there is absolutely no operational cost impact to the detention center for joining their study. Part of our partnership, it's been a great addition and or extension to our MOUD program that Mary Ann had just shared. It gives the inmates another opportunity or option if they do not want to join in with the MOUD program. And we have had some that don't want that, but they want friends. And it also gives, back to the diverting, when we catch someone diverting their MOUD medication, they are cut off. But now, with addition to that, we have friends. So they have one more opportunity, and I'm sure they're not going to divert the injectables that they get once a month. And like Mary Ann just touched on, it expands our network with our correctional administrators and treatment experts to learn and to grow as one in our correctional field. Part of the communication process. So medical and or myself will send friends the referral. Either the inmate will ask us, they'll send me a jail mail request, or when medical meets them at intake and they don't want to be part of MOUD, medical will mention friends. So Morgan and I tag team that and send that to Dr. Gordon. They are very quick at responding and scheduling with our detention center. So they schedule the pre-screen to make sure that they are eligible for the injectables. And then they schedule the baseline medical visit to gather the medical history and do the physical examination. The communication between medical, myself, and friends is effortless. It's very quick, and friends is very quick at responding to any of our questions or concerns that we have. And as the inmates continue on, like Dr. Gordon said, and most of us know, our pretrial population is most likely higher than our sentence population. So I will send Dr. Gordon release dates of inmates if they are sentenced, contact information for when they get out. So if they are pretrial and they go to their court date and they get out, for friends, in order to follow them in the community, I'll give them their home address or a friend's address that they gave us, phone number, so they can be contacted on the outside, as well as updating them with the scheduled court dates, because also we know that court dates get pushed out 5-6 times until they're sentenced or go up the road or just get released. And then I also update them on the adjudications. Like recently we had an inmate that was on Friends for a few months and got an 8-year DOC sentence. So I had to obviously let them know about that. So re-entering into society, the inmates are not forgotten if they're with friends. The study doesn't terminate. It continues with them on the outside. Friends tracks their clientele. They administer the medication and they follow up with them in the community. They have partnered with Pyramid Warden on the outside. So when the inmates are released from our facility and they are part of their study, they will contact Pyramid Warden to be able to administer the medication or just to find out how they're doing in treatment, and to just keep that continuum of care going. The inmate is, upon release, inmate is paid for their time taken out of their day to for friends to collect data with questions that they may have for the inmate. Already touched on that. And then they are followed up after 12 months to see how they're doing. Having friends, they are there to help bridge any gaps that we may have in our county. They can help bridge them on the outside. On the screen, 26 have been pre-screened in St. Mary's since January of 2020, with 24 consenting, and it's an even amount of randomization, 7 with Vivitrol and 7 with Brixadi. And as we know, data collected from this study, or any study for that matter, it helps establish facts, reach new conclusions, and increases knowledge on opioid use disorder and treating of the disorder, which will assist in future advances. We're not just helping out those now, but we're helping those out 15, 20 years from now that we may come across. Overall, it helps build a better community. Being an MOUD, we know that if they're addicted, they can't work, or if they're working, they're not functioning. So being on MOUD allows the individual to assist with managing their addiction, successfully working, regaining and maintaining healthy relationships with their family and friend, and being able to participate in their communities in a positive way. And that's the biggest take for being part of and having an MOUD program and the partnership with friends. Is making sure these individuals are released and they continue on a positive path and can regain a positive outlook in our community. And that's all I have. I think that's our last slide, isn't it? Just our contact information.
Hi, can you guys hear me? All right. I'm Christy McMillan. I'm the reentry coordinator with the Allegany County Detention Center. I'm just going to give an overview of our program, where we were and where we're at and how we got there. We provide a bridge prescription if their appointment for their medication is, if there's a time lapse between that. Typically, we try to make sure that their medication appointment is within a day or two. We don't want to send them out with too much medication in hand or a prescription. We want them linked to a provider as soon as possible. So we've had JSAP, which is the Jail Substance Abuse Program, since 2016, which is an IOP program that is provided by the local health department. Then in 2016, also, we had an MOU with the local health department to do medical assistance, which is very important, and it's a requirement of the bill. To make sure that they have their medical assistance before release. They come out there. I think they do that with all the local detention centers. And then in 2019, we partnered with a local methadone clinic, and they had provided us with guest dosing. So if they were already prescribed methadone, then they would come out and guest dose those individuals with their methadone. And that was pre-House Bill 116. So we had some stuff in place, and then we just built upon it over time. Last year, we employed a nurse, and her sole responsibility is our medication assisted treatment program. She dispenses the Subutex, and there is a protocol for that. We also employed last summer another reentry coordinator. So she kind of took on the duties that I do, and I case manage those that are on medication assisted treatment. They get close case management, and they are set up with services before they are released with a comprehensive reentry plan. Medical, JSAP, the reentry coordinators, custody staff, we all work very closely together. At day 2, 48 hours, they are provided a urinalysis and to see if they have an opioid, if they have opioids in their system. And that is triggered by, we had already had in place the expert screening at booking. So we look on the expert screening to see if they report opioid use, fentanyl, heroin, any of those. And then that triggers the urinalysis, a brief mental health screening, and a brief substance abuse screening, which the reentry coordinators do immediately after the urinalysis. Then they are, if the brief screenings indicate that they have a mental health or a substance use disorder, they are then referred to our JSAP program counselors and to our therapist. If they are on medication for opioid use disorder, they are referred to the mental health as well, so that we can take care of both mental health and substance abuse. They are closely monitored throughout their incarceration, and then they are set up with a reentry plan. We have partnered with community providers. We have somebody coming in to do Sublocade injections and Vivitrol, Zamela Wellness. We also partnered with AHEC West, and we have 3 peer recovery specialists. We have 2 males and 1 female. Everybody that is on medication or in JSAP is required to have at least 1 contact with a peer recovery specialist. We also do it in a group format as well, so that their services are reaching everybody. Our female recovery specialist brings in recovery yoga every other week for the females, and they seem to enjoy that. So that covers, 10 at a time for time's sake. And so we are able to provide all 3 formularies of the medication. And we keep a close look at their release dates to make sure that they are not going into the community without an appointment somewhere. And then if their appointment has to be set out, then we provide them with the bridge prescription and to get them through. And we follow up to see if they've made that appointment, the first appointment that they're supposed to attend. So that's an overview of the program. If anybody has any questions.
I was wondering if you could talk about some of the challenges about hiring recovery specialists. Come work with you, because I know that's part of the bill and might be some concerns for some of the jails.
Luckily, prior to all of this, we had created, we have through AHEC West, we have what's called Healing Allegany. And that is a reentry case management program in the community for those with opioid use disorder. So we had already had that in place. And so we built upon that. And then we started out with 1 peer recovery specialist. We found that that was not enough. And so then they employed more, and they're actually hiring more. And also they provide Narcan training, and our local health department provides Narcan for all those released into the community. So we actually had a collaboration with another agency already in place. So we've been building upon this and to get to where we're at. It's been very helpful. If anybody would like, I do have contact information for the peers, and they have a lot of resources, just not in my county, but other counties if people would like that information.
I have a quick question. So both of you, both in St. Mary's and Allegany, all of your services to one degree or another really predated HB 116. And you are really definitely building upon that. One of the ways it seems like you've been expanding those services are with your partnerships, like with St. Mary's, with us. I know you all in Allegany with the University of Maryland in terms of those kinds of services. Can you talk about how you found those kinds of partnerships, or ways that you are sort of building upon or learning for in terms of services that you would extend or provide once maybe your current contracts are ending?
So in St. excuse me, in St. Mary's, we had a relationship with Pyramid Walden, so we just expanded upon that. And so we just expanded, we added like Kim's position to that. And as far as like medical, we do not have 24-hour nursing coverage in the facility. So we had to go out and we had to hire a registered nurse to be able to take and to help facilitate that. And it's been challenging just with COVID, just to be able to get people in, to get them hired. It's challenging in the detention center to get past the background, but to be able to hire, it's taking time. And I know in our substance abuse program at the moment, we've had a vacancy since, not for Matt, but for another one it's been a while. So we've had replacements coming in, and thankfully Walden filters people in to backfill for the hiring.